Hi, I'm Bridget. I'm going to be your student nurse today.
Okay.
All right, can I get your name and date of birth, please?
Savannah Buck, 7/31/86.
All right, awesome, Savannah. How are you feeling today?
I'm feeling good, actually.
Okay, and what is your pain scale on a level of 1 to 10?
I would say it's about a 2.
Okay, so not too bad. All right, I'm going to start with some vitals, okay? I'm going to get your temperature to start off with.
Perfect.
Have you had anything hot or cold to drink in the last couple of minutes?
Nope.
All right, 98.6. Perfect. All right. All right. And now I'm going to get your blood pressure, okay?
Awesome.
Good. Perfect blood pressure, 120/80.
Good.
Okay, and I'm going to be listening to your apical pulse for a full minute to get your heart rate, okay? 68 beats per minute. And I notice your respirations were at 18 breaths a minute, which is good. All right, and now, have you been having any tenderness in your breast at all?
No, no tenderness.
Okay, any pain?
No, actually.
Have you noted any discharge at all from your breasts?
No.
Okay, I'm gonna go ahead and palpate them if that's okay.
Yeah, that's fine.
Okay. Are you breastfeeding?
Yeah, I am.
Oh, that's awesome. So just like a quick couple of tips right now while I perform this assessment I can talk to you through. Your baby's stomach is about the size of a grape, so he or she is not gonna be like eating a whole lot right now, so you want to feed him every like couple of hours, okay?
Okay.
All right. The breasts are soft. They're not firm. Do you feel any? You don't feel any tenderness when I'm doing this?
No, not at all.
Okay. The nipples are intact, and so pretty good. All right. So I'm gonna go ahead and listen to your abdomen, okay?
Okay.
Alrighty. I'm just gonna lift up your gown here.
Right.
When's the last time you had a bowel movement?
I haven't had one yet.
You haven't had one yet?
No, I'm kind of scared too.
Okay. Do you know if you ripped it all
No.
during your? Did you have any tearing in your vaginal birth?
I think they said there was a couple stitches they had to put it down there.
Okay, so just a couple. Okay, well you shouldn't be scared to go. It might be a little bit uncomfortable at first, but it's better for you to go, better for your body. If you don't feel like you can go, if you're feeling constipated, getting up and walking around, drinking lots of fluids, eating foods with fiber can really help you, get up and feel the need to go.
Oh.
So, and when you need to go, you should go, okay?
That's a great idea. Okay.
Okay, I'm gonna listen to your abdomen, okay?
All right.
All right. Bowel sounds in all 4 quadrants are active. Okay. Have you been passing gas at all?
Yeah, actually.
Okay. So you're feeling the need probably to have a BM pretty soon here?
Yeah, actually, probably.
Okay. All right. And have you peed at all since your birth?
Actually, yeah, I have.
Okay. Any discomfort or anything with that?
No,
Any
not
pain?
at all. No.
Okay. And just things to look out for. You're gonna want. Did you get a epidural?
Yeah, I did.
Okay, so that does kind of numb your lower body, and it can leave some. You might not notice when you have to pee. So you're gonna want to make sure you're still getting up and walking to the bathroom at least every couple hours or so. Okay, so you're not having all that residual urine left. Okay.
Okay.
Because that can lead to some more infections the longer you hold it in your body. Okay.
All right.
All right. Awesome. So now I'm going to be palpating for your uterus, okay, using the 2-hand technique.
Okay.
Okay. All right. So it's going to be right 2 centimeters below your umbilicus, midline, and it is firm.
Good.
All right. All right, very good. Okay. So do you have any questions so far at all?
No, I don't think so.
Okay. I'm just gonna have you, I'm gonna have you shift over, okay? Because I'm gonna be looking at your backside, just to look at your episiotomy site and your epidural site, okay?
Okay.
All right. Don't need those. Okay. So I'm just gonna uncover you a bit here. Alrighty. I'm gonna have you grab the side rail. Thank you. All right. Okay, so doing good. There's a couple of stitches. They're intact. All right. And your epidural site is good, intact. No redness or anything noted around it. All right. Okay, so there's no redness, edema. Okay. So now, have you been seeing any discharge when you've been going to the bathroom?
Yeah, actually, it's kind of weird. I don't know what it is.
What color has it been that you've seen so far?
It's been like it's red, like I'm bleeding from somewhere.
Okay, so a couple days after birth, it's completely normal to continue to have red bleeding, which is called rubra, lochia rubra. Lochia is the term we use for post-birth bleeding. So that should last for a couple of days, okay? And then there's like 3 stages to it. So the next type of bleeding would be lochia serosa, and that can last for a week after birth, or a week or 2. And then you go to the 3rd stage, which is lochia alba, and that's kind of a whitish yellowish, and that should be the last stage of discharge, and that can last from 2 to 8 weeks after birth. But if for any reason you were to go backwards in that bleeding, like let's say you were at lochia alba, which is whitish to yellowish, and then you went back to lochia serosa, which is kind of a pinkish brownish tinge, you would want to contact your healthcare provider if it was like a large change back, okay?
Okay.
All right, so I'm gonna just go ahead and take a look at your pad here. Okay. All right, so yep, I am seeing some lochia rubra. When was the last time that you changed your pad out?
I would say it's about an hour ago, actually.
About an hour ago?
Mm-hmm.
Okay, perfect. So we usually scale it. I would say it's a moderate amount on an hour scale. All right. Okay. So just want to make sure you're changing that pad often, okay? Because you want to keep that area clean down there and everything, okay?
Okay. You didn't see anything abnormal, though? I'm kind of worried about anything.
If you have any clots, you want to contact your provider if there are any large clots, probably larger than the size of like a grape this big, so you want to watch out for that. But nope, you did not have any clots. And also your odor, it smelled just like normally. But if you do notice kind of like a more stronger, intense smell down there than you normally have, you're also going to want to contact your doctor because it could be signs of infection, okay?
Okay, good. I've really been worried about that.
Yeah, so as long as those things are fine.
Okay.
All right, and I'm going to go ahead and look at your calves, okay, for DVTs, which is deep vein thrombosis. This is another reason why you need to be getting up and walking around, okay?
Okay.
Because those can lead to a clot that can lodge somewhere else in your body, which would not be good. So really, getting up and moving is very important after giving birth, okay?
Okay.
So I see no swelling in either calf. There's no redness or edema noted. Do you have any pain in your calf at all?
No, not that I've noticed.
Okay, good. All right, and I don't feel any warm spots or anything. So just make sure you're looking out for those signs and really if you're and also for exercise, getting up and walking to the bathroom is not sufficient exercise. You're gonna really want to get up, and you can take your family member with you, or just whatever, and just go for like maybe a longer walk around the hall or around the hospital. Okay.
Okay.
All right. So, and then I'm just gonna be checking your IV site too. Good. There's no redness. Doesn't seem to be infiltrated at all. Do you have any pain at your IV site?
No.
No? Okay, awesome. Yeah, so, and your dressing was intact. Everything looks good there, okay?
Good.
And then I just wanted to state that the patient's emotional state is good. She seems happy, content. She doesn't seem very anxious filled. She seems probably moderate for a new mom who has a couple of questions. And yeah, so, yep. And she had peed and she did not have a Foley in, so